A 30-year-old female presents after falling onto an outstretched hand. I am showing you the radiograph of the hand. Describe the findings.
Right, so the hand radiograph demonstrates shortening of the fourth metacarpal. No acute fracture, dislocation, or joint subluxation is identified. The bones show normal mineralization with no focal lytic or sclerotic lesions. The findings are consistent with an isolated idiopathic shortened fourth metacarpal, or possibly secondary to childhood growth plate trauma.
What is the differential diagnosis for a shortened fourth metacarpal or metatarsal, and which conditions should we consider?
The differential diagnosis includes previous trauma, post-infarction changes from sickle cell disease, Turner syndrome, pseudohypoparathyroidism, and pseudohypoparathyroidism. In children, prior fracture involving the epiphyseal plate can cause premature fusion and shortening. Sickle cell disease causes microinfarction during dactylitis, leading to growth arrest. Genetic and endocrine syndromes must be suspected if the shortening is bilateral or involves multiple metacarpals.
I am showing you radiographs of the hand and foot from a patient with a related endocrine condition. Describe the findings and how they differ from the primary case.
The hand radiograph demonstrates marked shortening of the third, fourth, and fifth metacarpals, while the foot radiograph shows matching shortening of the third, fourth, and fifth metatarsals. These multiple bilateral shortenings are characteristic of pseudohypoparathyroidism or pseudohypoparathyroidism. Unlike the primary case of isolated fourth metacarpal shortening, this represents a generalized genetic condition of end organ resistance.
Differentiate between pseudohypoparathyroidism, pseudohypoparathyroidism, and Turner syndrome.
Pseudohypoparathyroidism is a congenital endocrine disorder where there is end organ resistance to parathyroid hormone, resulting in hypocalcemia and hyperphosphatemia. Clinically, patients present with a short obese stature, round face, abnormal dentition, and short metacarpals. Pseudohypoparathyroidism has identical physical and radiological features, but biochemical tests show normal serum calcium and parathyroid hormone levels. Turner syndrome affects females with a 45XO karyotype, presenting with short stature, a webbed neck, small iliac wings, coarctation of the aorta, horseshoe kidney, and Madelung deformity of the wrist.
How would you manage this patient as a radiologist?
As a radiologist, I would recommend comparing this hand radiograph with prior films or imaging of the opposite hand to confirm whether the shortening is bilateral and chronic. I would suggest obtaining radiographs of the feet to evaluate for any associated shortened metatarsals. I would suggest checking the wrist for a Madelung deformity, which would favor Turner syndrome, and coordinate with the clinical team to obtain serum calcium, phosphate, and parathyroid hormone levels to rule out pseudohypoparathyroidism. Finally, I would document this finding as most likely idiopathic or post-traumatic and refer for clinical genetics evaluation if syndromic features are present.